Yeah.
Okay. Welcome to one of our CAC roundtables. I'm here with Mrs. Goldie Davis of the Department of the Social Services. We're here to ask a couple of questions, get a little information for the community. Can you tell us about some of your services?
We provide FNS, which is Food Nutrition Services, to clients that come and apply. And if they're approved Medicaid, it's adult Medicaid, which is actually Medicaid for the aged, the blind, or the disabled. We have Family and Children's Medicaid, which is Medicaid for children and custodial parents. We provide child support, which means you can come in and establish a case for child support. And we also maintain that case for the client. We provide Work First benefits. Work First covers subsidized child care assistance for parents that work and they need daycare. We have a voucher system that's for them. We have within that we have employment services, classes to help with employment. All that falls under Work First and EA, which is emergency assistance. If they need help with rent, different things that fall under that category, they can get assistance for that. We also have FNS, Medicaid, Work First, child support. I'm trying to make sure we get children's services, which is CPS, Children's Protective Services. So if there is a report that of neglect or abuse that's made, and that would be processed through Children's Services. We have a department with social workers that follow through with that. And under Children's Services, it's also foster care and adoption. So if the child is removed from the home, they can be placed in foster care. That part of the agency also does the licensing for the foster care homes and adoption. And adoptions is for children that are placed in foster care and then they are adopted out. And there's assistance with that. There's also a Medicaid that goes with that as well. And we also the senior center. So the Department of Social Services, a lot of people don't know that the senior center downtown is a part of the Department of Social Services. And it provides lots of activities. We have a feeding program, lunch program for the seniors. Before the pandemic, they had trips, activities, all of that was spearheaded in the senior center is a part of the Department of Social Services. So we actually are one agency that's located in 3 different locations.
Who's the head of the department?
It's Danita DeVega. She's the director of the agency. She's been there almost 2 years in February. We're excited for her leadership. It has infused so much new, different, dynamic things. We're excited about her being our leadership. Her name is Danita DeVega, and she's our director.
If somebody wanted to get in contact with Ms. Danita,
you just call the regular number and ask to speak with her, and it'll be transferred to her office.
Okay.
And they speak to the personnel assistant that's there, and she's available. You may have to schedule her talk, but she's available.
Okay. Was there any changes made since COVID with the services that y'all offer?
There were no changes as far as our services because what we do is essential. So we never did close our doors, but we did make some changes with, we didn't have clients that were coming in unless it was an emergency or they were insistent. So we still provided services via the telephone, online, email, fax, any way that we could get it in. So, but as far as providing the services, we continued, but we follow the CDC guidelines and also the public health emergency. We follow the guidelines of the governor of how of our contact with the public and things like that. So there were some changes with that. And even now, we are on a limited client access plan. The doors are open. You can come in, but we allow 10 people in the lobby at a time.
Okay.
And we also allow only 2 people back in the offices, and they have to have a mask on if they need to come back in one of the individual caseworkers' offices. But we are still providing the same services. We just have followed the CDC guidelines and followed what was mandated in the public health emergency by the governor on how we conduct business, but our business is essential, so we have continued to provide it.
No. Are there any special services due to COVID, like a lot of people, out of jobs and can't pay rent and things like that?
We still have the same services.
Okay.
And so what we've seen is an increase of people that need those services for emergency assistance. Like I was saying, that's under the umbrella of Work First. And you can come in, and if you have an emergency that falls within the guidelines and you meet the eligibility factors, there's assistance for rent, light bill, deposits. If you're working and you have a car and you are part of the Work First program, there's assistance with car repair. There's assistance with gas vouchers. So all of those things continue, but we have seen an increase because of the pandemic. It has thrown a lot more people into crisis that weren't before. So we still have those services. Some things that changed with FNS, which is food stamps, where when you do an application and based on your income and based also on your household size, you were deemed eligible for this amount. But with the pandemic, everyone that's receiving is receiving the maximum allotment for that household size. Though if it weren't for the pandemic, it would be less than that. So that has been mandated. So it has been the maximum allotment. Recertifications have been extended, where every 6 months you would have to do a recert, and then it may be a change would affect that, but it has been deemed that by the government that the recerts are being extended, and it's also and you can bring that information in, fax, telephone, online, and you can also do what's called with the applications telephonic signatures for certain parts of programs that we have, and it's to just so clients won't have to come in and put themselves at risk because we are in a pandemic. So the state has been very good with accommodating that, with making changes so that the services that are provided continue, and some at a higher level.
Speaking on the food stamps, how can somebody qualify for food stamps?
They would come in and apply. For all of the programs that I talked about, you'd have to come in, apply, you'd have to provide verification. All of them is your income and your household size, who lives in your home, how much money do you make, and questions like that. And after they get all the information in, and it's processed in our system, NC-FAST, then you're either deemed eligible for food stamps is a certain amount for each household size, and based on the income, that'll be based on how much benefits you get. So it is the same way. The only thing is we're encouraging everyone and making it available that they can apply online, fax, email, so that they won't have to come in and they can feel comfortable continue to receive their services without being exposed.
How have the department been getting information to the community?
We use the same methods of media. We've got a website. We also do media plugs with the radio. We have a good community relationship with them. On our website, we put things out, and we have postings all over. If you come in the office, we always post different things, and the state sends out certain information themselves to all of the recipients, letting them know different programs like child support. It has an app that you can download on your phone, and you can keep track of your payments. If you're the custodial parent, it's when something is posted, things like that. You can email your caseworker. With FNS, there's an app. You can download that and have access to information. With Medicaid, there's an app. So it's a lot of technology is being used so that clients can access the information for their own personal cases, and also just general information. That information is out there.
What are the qualifications for Medicaid? Like, how can somebody qualify for Medicaid?
They have to come in, they have to apply.
Okay.
And it's based on your income. It's also based on your household composition. There are two departments of Medicaid. And so one of them is adult Medicaid, and the other one is family and children's Medicaid. And adult Medicaid is a misnomer. It can mislead people. It's actually, like I said earlier, it's Medicaid for the aged. That means you have to be 65 or above. Medicaid for the blind, that means you have to be declared blind based upon the Social Security definition of being blind, or you have to be disabled. So if you're not 65 or blind, then you have to be 64 and under. You would have to be declared disabled. DDS is the agency that we send it to at the state level, and with all of the information that's compiled and given by the client and by the doctor, is a determination made if you're disabled. If you're not determined disabled under 64, then you wouldn't qualify for Medicaid. But for family and children's Medicaid, you can receive that Medicaid based on the household composition and your income up until you turn 21. So it's a little different. A lot of times people think that once you age out of family and children's Medicaid, you just go into adult. That's not true. You have to meet those three requirements. And for family and children, if you're a custodial parent and you have minor children and your income size meets it, then you, the parent, can qualify for Medicaid and the children. And for the parent, the custodial parent to qualify, one of the eligibility factors, which means that in order to be eligible and receive, you have to meet that, is if you have non-custodial parents outside the home, you have to cooperate with child support, which means that you have to give them any information that you have so that they can contact and reach out to the non-custodial parent so that they can participate in caring for the children.
Can you explain a little bit more about the work first
Yes.
services?
I can.
I seen online it said help with cash assistance.
Work First is what used to be called AFDC or welfare years ago, and it's a cash payment to families that qualify, that are trying to get on their feet. You have to be, and I don't want to, because I don't work with that all the time, but I know some eligibility factors is working or looking for work in school or looking, or in school or getting ready to go to school.
Okay.
Those things like that. You can't just be not doing anything. So, and what it is to get the clients to where they're employable and they can be employed. So there are classes that they take on interviewing and about to make them more employable, to give them the skills that they need to interview well and all of those things. So Work First is about that. And cash assistance is where you can receive a monthly check and you can, and cash that's available under the Work First umbrella is, like I said before, if you have a car and you're working and your car breaks down and you fill out the application and follow the protocol for that, you can get the funds needed to get your car repaired so you can keep working.
And you don't have to pay that?
No.
Okay.
It's a service for Work First. So no, it's not a loan, it's a part of the Work First. You can, with Work First, like I said, you can get help with that. You can get help if you're in a crisis and you need some oil, or you need to pay your light bill, or you need to get your water bill, or it's being turned off, or you need a deposit for your water bill, or you need a deposit for rent. There are funds that are available under the umbrella of Work First where you can receive assistance for that. So and child care falls under that. So it covers a lot. LEAP, I don't know if you heard of LEAP. A long time ago, it used to be called, you hear people say, I'm gonna get my check for my light bill. Once a year, you get it. But now it's LEAP, it's Low Income Energy Assistance Program. And so once a year, December it starts for the seniors, and in January, you can come in and apply. And if you meet the qualifications, you can be approved for a certain amount, $200, $300, $400, and it's directly paid to whoever your heating source is. And so you come in, it's a household size, almost all the eligibility factors is your income, your household composition, or your size. And so they take that application and it's processed, and whatever you're approved for, whatever your heating source is directly paid to them. But it's of such a great help, because some people their whatever the heating source may be $100, and they may qualify for 3 or 4.
Yeah.
So they'll pay it up for like 3 or 4 months.
Yeah.
So it's a great
gives them time.
service. Yeah, it's a great service in our community.
Can college students qualify for food stamps?
I want to say that if you're in school actively, that disqualifies you for food stamps.
If you're on campus and all that?
Yes, it's not work rate. It's an eligibility factor that's specifically about if you are a full-time student. And I don't want you to, I'm almost positive, but I can verify, but I think that's one of the factors that you can't be a full-time student, because it's something that it has come up before. Because if you're just looking at it on the outside, it's like, I'm not in my mom's house, but I don't think so. I don't think you qualify if you're a full-time student. But I'm gonna call you back.
Okay.
And verify that to make sure I'm giving you the correct information.
Okay.
And I'm gonna have policy, okay?
Do y'all help with like somebody that needs like let's say somebody got kicked out of their apartment and they looking to move it to somewhere else? Can y'all help with that?
It depends on the household size, the income. They can come in and apply.
Okay.
And if they meet the eligibility factors for whichever program, and the program determines the funding, if they meet the eligibility factor, they can be assisted with a deposit for a rent,
Okay.
deposit on a house. But it's not like a blanket, yeah, I got kicked out, so yeah, I'm going up there. It's not like that.
That's if you need the assistance.
Yeah, and you meet the eligibility factors
Yes,
and the
ma'am.
criteria, then yes, you can receive assistance.
Yes, ma'am.
But yeah.
I think that's all we have for today. You have anything else you wanna add?
No, I just want everyone to know that the Department of Social Services is continuing to provide services. There's not been a break in providing services. Our services are essential. We have been open. We are continuing to do work. We have, the doors have been shut based upon, like I said, the public health emergency, but there are multiple ways to contact your caseworker to apply. You can do it by phone. You can do it online. You can do it via email. You can do it faxing. So if you need some assistance, you can call. The number is 252-492-5001. And when the prompt comes up, it'll tell you which department we are available. We're open from 8:30 to 5. And we want everyone that might need assistance to know that we are open for business for the, to assist the citizens of Vance County.
I wanna thank Ms. Goldie Davis for giving all this information. Please, if you need any services, go to the website, contact me. We'll figure it out, help you out. Check us next Monday at 4 o'clock for our next CAC roundtable. If you have any questions that you want us to ask anybody, send your questions to cac@ci.henderson.nc.us. That email again, cac@ci.henderson.nc.us. And we'll see everybody next week at 4 p.m.